We do want to make sure that your questions about the coronavirus are answered, and our focus tonight is mental health. Joining us is Kayla Martinez-Johnson, staff psychologist at Prairie View A&M University.
Thank you so much for joining us. First off, we want to talk about the many layers to the mental health issue during this pandemic. Let's start with these stay-at-home orders. These stay-home orders. People are spending days and days in one place, either alone or with family members in some cases. What are some ways to cope with anxiety and depression?
Yeah, definitely. I want to normalize those feelings of depression and anxiety. These are very uncertain times, and so it's very normal to feel some anxiety, some depression. And one of the top suggestions that I would make is that people kind of limit how much news they take in. That might mean blocking some news feeds or turning off some social media notifications. Another is to just stay connected, but do it virtually, obviously. You need to be surrounded by people in a virtual space to be able to talk about what you're feeling, what you're experiencing, and the stressors that might be occurring. Another tip is to just create a new normal, right? So all of our routines have been disrupted. Things are different now. And so part of that is focusing on the things that you can control and accepting that things might be different for a while. And especially the top tip is to seek help when you need it. If your depression and anxiety is getting to a point that it is interfering with your day-to-day life, your relationships, your ability to work, don't be afraid to reach out to a therapist. Teletherapy options are available during the social quarantine period. And a lot of times telehealth is actually more accessible and more affordable than face-to-face services. So now's a good time to get started with a therapist.
Great recommendations, Kayla. Let's shift it now to our children, young children as well as college-age kids on your campus. You mentioned a very important word, connectivity. It's critical for our kids. Let's go through the kinds of feelings that our younger generation is dealing with during this time and how they can cope with it.
Of course. They're also feeling some worry, some anxiety. I think about our young kids who maybe don't have a routine anymore and they can stay up late all night and eat whatever they want, and they don't really have a good routine, and that's not good. Our college students and high school graduates who are having to postpone graduation and prom and very important sporting events, that's obviously going to make them feel disappointed, frustrated, worried, and anxious. Some things that we as adults can do to support them is to definitely stick to a routine, right? Kids thrive when they feel secure, when they feel safe, when they know what's going to happen, and when they feel secure. So maybe creating a daily routine for those students who are now at home, right? And also creating a safe space, because a lot of times, home is not safe for some kids, and school is the only place where they feel safe. So making sure that you create a safe space for them where you actually listen to their concerns and don't minimize, don't invalidate what they're going through. It's scary enough for us adults, so I can imagine just how scary it is for them. You want to have patience with them and model those coping skills, right? Because if we're falling apart as parents, they're going to see that and model that behavior too. So be open with them, listen to them, be patient, and I can't stress enough, if it gets to a point where they're experiencing depression and anxiety, don't be afraid to contact a mental health professional.
All right, one last important group to talk about, those healthcare workers and professionals. They're used to working long hours in stressful situations, but this has taken it to another level, as we all know. How can healthcare workers deal with feelings of depression and anxiety?
Yeah, so our healthcare professionals, my heart goes out to them because they are facing some very unique challenges of not only having to take care of their patients, but then taking care of themselves and their own family, right? And so ways to cope with those unique stressors is to take care of the basics. So we often say that you can't pour from an empty cup. So make sure you're getting enough sleep. Make sure you're eating, and not just a snack from the vending machine, but an actual meal. Make sure that you're taking breaks whenever you get them, and setting appropriate boundaries too. Just because you push yourself to the limit and to the point of exhaustion doesn't mean that you're doing good work, right? And you also want to stay connected with other colleagues, with family members in a virtual space, and limit your exposure. And I'm going to say it for a third time. If you're experiencing burnout, secondary traumatic stress, or just need a space to vent, call one of us. Call a therapist, call a professional helper. We're available.
Yeah, self-care is critical during this time. Kayla Martinez-Johnson, thank you for being with us, staff psychologist at Prairie View A&M University. We appreciate your input.
Thank you. Thank you.
All right, we're paying tribute to those healthcare workers on the front line.